Hi, my name is Julie Morrone. I am the certified school nurse at Neshannock Township School District. I wanted to help answer some questions that you may have regarding our COVID-19 procedures for our health room and students. We have several resources available on our website regarding COVID-19. Please visit NTSD.org, select departments, and click on the COVID-19 tab to access this information. What I would like to do with you now is review this flowchart that is available on our website to discuss when you should keep your student home from school. The first category is to ask yourself, do you have at least 2 of the following symptoms? If your student is experiencing headache, congestion, body aches, muscle pain, chills, runny nose, sore throat, or nausea, please keep your student home. Does your student have at least 1 of the following symptoms? A fever of 100.4 or greater, cough, difficulty breathing, loss of taste or smell, vomiting, or diarrhea? If the answer is yes, please keep your student home. If no, you can send your student to school. Has your student been within 6 feet of someone diagnosed with COVID-19 for 15 minutes or more? If no, your student can come to school. If yes, please keep them home. Have you traveled to an area where there are high amounts of COVID cases? If no, your student can come to school. If yes, your student needs to stay home. For anyone who has traveled to an area where there are high amounts of COVID-19 cases, you must quarantine for 14 days upon your return to Pennsylvania. If you are unsure if your state you have traveled to is on this list, please consult our website for a direct link to the Pennsylvania Department of Health's link to traveling. If your student tests positive for COVID, they must remain isolated for 10 days. They can return to school after this 10-day isolation is complete and they are fever-free for 24 hours without the aid of fever-reducing medication and their symptoms are improving. If your student has a negative COVID test, he or she may return to school once they are fever-free for 24 hours without the aid of fever-reducing medication and their symptoms are improving. If your student is experiencing symptoms related to COVID-19, he or she may return to school after 10 days as long as they are fever-free for 24 hours without the aid of fever-reducing medication and their symptoms are improving. Or if they can provide documentation from a medical doctor of a non-COVID diagnosis. If you've been identified as a close contact to a confirmed COVID-19 case, you will need to quarantine for 14 days. Should you have any questions regarding the quarantine process, please reach out to the Pennsylvania Department of Health or your medical provider. I am also available to assist you with any questions you may have. As always, please continue to visit our website, ntsd.org, for updates and information. Thank you for your continued patience, support, and commitment to mitigating the spread of COVID-19 in our community.